You can start, Ifat. I've started the recording. Yeah.
Okay. Hello everyone, good afternoon. I'm the president of AIHSAYA from Delhi. Welcome you to the first webinar of AIHSAYA from Delhi. And now I'm going to introduce our General Secretary, whose name is Usama Ali. He will tell you the brief about AIHSAYA Association and the ARCO members. Welcome Usama.
Okay, thank you, ma'am. Good afternoon, everyone. So, myself, Osam Ali, welcomes you all in the first release webinar of AIHSAYA. So, basically, AIHSAYA stands for All India Homeopathic Students and Youth Association, which is basically a non-political organization whose aim is to inspire, promote young minds for the upliftment of homeopathy at national and international level. So, as our Delhi committee has also been formed, so let me introduce the committee. Our President Dr. Ifat, Vice President Dr. Karthik Nigam, Dr. Naman Nigam, Dharmendra, Jyoti Mahe Sahu, Nancy, our Assistant General Secretary Nisha Qureshi, Shivangi Kumari, and Kapil. Treasurer Saima Shahid, Spokesperson Sahiba Sadaf, Akanksha Saxena, Himanshi, and IT Media in charge Shivani, Akhilesh Singh, Dr. Deepika Jyoti, our Culture Secretary Rituja Sandhya, Dr. Kiran, Dr. Nidhi Saxena, Game Secretary Sumit, Lakshay, Ramesh, and Executive Members Dr. Sudhir, Dr. Shahnawaz, Ashna Jain, Pratiksha, Kiran. And I am the General Secretary of Samali. So let me introduce the speakers. Today's speakers are Dr. Yashika Arora and Dr. Akshay Swami. Let me introduce about Dr. Akshay Swami. Dr. Akshay Swami is BHMS gold medalist and he is the global tutor at Homeopathic Academy Bijan, and he is also the recipient of Uttam Jeevanshali Award, Madhya Pradesh. And the our next speaker is Dr. Yashika Arora. She has completed her BHMS from Nehru Homeopathic Medical College, Delhi, and now she is pursuing her MD from Aurangabad. And she is also an STSH Scholarship Award winner by CCRH, and she is a youth icon in the homeopathic fraternity. So I welcome you all, and let's start. Please start. Ma'am, please start your presentation.
I hope my screen is clear to everybody.
Yeah, it is clear.
Okay, I'll just begin. I'll stop the annotation first. Dr. Naman, can you please help me? I need to. I have disabled. Yeah, thank you. So today we are going to study miasms. So I will be taking the part of Psora and syphilis and psychosis, and miasm would be discussed by our another speaker, Dr. Akshay Swami, who is more than me youth icon for everybody, and he's an inspiration for many of the doctors from his place as well as all over the country. So I am just a beginner, I would say, but yes, whatever knowledge I have, I'm going to share with you guys. So I think we should start with the session. People are waiting. I've disabled annotations. I won't face any technical issue, na, Naman? Hello? Please on your audio. Yeah. I've disabled annotations. Yeah. So we'll begin with the miasms and we'll study now. So first of all, we are going to study what is actually miasm. Miasm and how does it begin? The word, what is the source of this word? What is the meaning of this word? Though you have studied all in your organon books as well as it's available everywhere, but we'll discuss in short what is actually the concept of miasm and how does the miasm word originated and how does it comes. So I just want to brief you about miasms. Miasms are usually germs. They are usually pollutants. They are polluting exhalations, and it's being derived from the Greek word miasma. That actually means polluting exhalations. Or a malarial poison or an effluent that is arising from bodies of the patients. I request everybody to please mute yourself, whoever is the co-host. I have already asked you to please mute yourself because so that there is no disturbance. So yes, when you talk about miasms are dynamic disease. Dynamic means that is not that acts dynamically over the body. They are producing such powers which actually infects the human beings, which actually affect the human beings and produce some kind of a disease. So when you talk about actual meaning of miasm, it's being derived from past medical dictionary. I have quoted this line from Stuart Laws. This is being given in Stuart Laws. So what it actually means, miasm is in the more strict pathological investigation of modern authors. It is actually different from contagion. Though it is being related to contagion, a pollutant, a germ, or a disease, it is actually confined to the effluvia or from the human body. So it means that this is just an infection that is related to the human body when the body is subjected to disease. But when you talk about contagion, it does not it does not proceed immediately from the body. It may be contagion or germ may be found over your clothes or somewhere else over also. But then when you talk about miasma, it directly infects your body. The moment it comes in contact with your body, it goes inside, and it is confined to the human body only, not the things, not the clothes, not anything else. So this is the difference actually between the miasma and the contagion or the germ. But yes, it is actually a pollutant. It is actually a germ that is infecting the human body. So you should remember this when you talk about miasm as classified by our master Hahnemann. So he said there are these types of miasm. First of all, there is an acute miasm which can occur, and he has also talked about miasm in aphorism number 5, where he says about the fundamental cause of the disease, which is actually the miasm, fundamental miasm. Then you have other causes of the disease, so exciting cause and other causes. So yes, he has classified these miasms, these fundamental causes of the disease, miasmatic cause, into 4 following things. Acute miasm, which is usually for the for those diseases like cholera and plague, which are recurrent in their life, which occur recurrently, and non-recurrent are the chicken pox or smallpox. Those miasm which arise due to acute exacerbation, acute infection, or some or the other by virus like varicella is infecting, or any other virus which causes an acute miasm to occur, and then the body is being diseased. But those are non-recurrent. They won't occur in the life again. We have also got half acute miasm, that is of dog bite, as well as accessory miasm of cowpox vaccine. So when you talk about chronic miasms, which are the main and to be understood actually, because this is what leads to chronic diseases, as well as you guys, when you deal with cases, you see recurrence in the cases whenever they come to your clinic, patients come to your clinic. So what you see is that there are recurrence and the patient is not getting cured with the similar medicine as well. So that the cause behind is the fundamental cause, that is the miasmatic cause of the disease, which may be due to the Psora, due to syphilis, or due to the Sycosis. when you talk about miasms in just this is what I have summarized, and I was when I was going through the books. So this is what actually occurs. Like miasms can be Psoric, miasms can be miasm is syphilis, gonorrhea may occur, or tuberculosis, tubercular miasm is there. So when you talk about pre-birth, so when the child is in the when the child is not born, the child is inside the womb, so when he's born, and then when he goes on in life in the future, so how the disease evaluate, so that is what actually matters. So it can be miasms can occur the moment of infection, maybe during the birth trauma, or maybe due to vaccination, or maybe due to some circumcision, some surgery, or something which may infect the body, and the miasm may enter the body. So that will ultimately result when you talk about birth trauma. If the child is born and he suffer from some birth trauma, or there is some issue, so some during the birth, so that may result in a broken bone. Or when you talk about any circumcision or any surgery which which a patient goes in his infant life, or when he's in childhood, so what may happen, he may become afraid, or he may have fear of the such circumcision. So this all goes on, and these all results in the mental level as well as the physical level of the patient which is being affected, and that results as a presentation of one of the miasm, or two of the miasm together, or three of the miasm together. So when you talk about temperaments and miasm, the four main miasms, though Master Hahnemann stated three miasms, that is Psora, syphilitic, and Sycosis, syphilis and Sycosis. So when you talk about pseudo-Psora, also he mentioned about, so which was being termed by Dr. J.H. Allen as tubercular miasm. So I have summarized these four miasm as according to the temperaments. When you talk about Psora people are melancholic, melancholic temperaments people. They may be, they though they are quick alert and quick alert, but at the same time they're sad, they're depressed, and this is related to the element of earth. When you talk about Sycosis, those people are of more of phlegmatic temperaments, and they have a water element of a water element as more. And when you talk about syphilitic, they are of choleric temperaments, and they have more of a fire element inside them. And the symptoms and this presentation of mentals as well as physicals are exactly as per their temperaments as well as the element they are representing. When you talk about tubercular, they are of sanguine temperament, they are bloody, they are full of bloods, and that signifies the air element in them. So when you talk about these miasms, many of these stalwarts have also classified, like Dr. Ortega, Dr. Mazzi, Dr. Flurry. Many people have classified miasms through different examples, like Ortega, Ortega has quoted for Lycopodium and Calcarea, and Dr. Mazzi has also talked about tertiary Psora, secondary Psora, how Psora results into primary Psora, then it goes on to secondary Psora, and then it goes on to tertiary Psora. So when you talk about all these things, so the gist which comes out is which everybody knows actually is Psora is the miasm of deficiency, Sycosis is the miasm of excess, and syphilis is the miasm of destruction. So what comes out is Psora koi bhi functional, if there is any functional change, functional disturbances in the body, or there is something deficient, there is there is something deficient inside. So when you talk about Psora, and when there is something excessive, there is some exaggeration in the body, you talk about Sycosis. There is hypercholesteremia, hypertension. Things are at the hyper level. They are excessive. Growth is there. So you talk about Sycosis. And when you talk about destruction means the body is becoming destructed. The body is going towards the end. The body is I would, you can say, the excrescences which occurs, and the body is a cancer, or you can say many of the diseases which leads to the destruction, which have destruction, or there is body which is becoming bad, diabetes or diabetic foot or such diseases. When you talk about, they may be considered as syphilitic. So when you talk about these stages of miasm, this is a very good example which when I was compiling this presentation and I was reading Freud's stages of miasm. So I just related it with the psychology also. And I would love to share about it. So Psora, when you talk about, is actually itch. Everybody knows that Psora is itch, psychosis is gonorrhea, and syphilis is destruction. So when you talk about Psora, the Psora represents lack. Something is missing, something is he's fearful, he's cold, he's hungry, and such features which we'll be discussing further in the presentation. But when you talk about these stages which are occurring in Psora, so these stages have sufferings of Freud's oral stage. The oral stage which Dr. Sigmund Freud was discussing. So this can be related to those oral stage wherein there is infinite love from mother, and there is child egoism which is occurring. So you can consider it as the oral stage of Dr. Freud. And when you talk about psychosis, which is representing excessive power, excessive growth, we can say there is lack of control, there is growth going on in the body. So when you talk about this stage, this is the anal stage of Dr. Freud. And when you talk about syphilis, which is leading towards destruction, which is having jealousy, envy, murder, and resulting in this, so that is actually the progression, which is the Oedipus complex. That is the third dimension of love, which is progressing towards the infinite love altrusion. So this is what is Freud's stages, which is being related with miasm. So what he want to say is that psychologically the patient develops, whenever a person develops psychologically, he is being influenced by three forces. So these three forces, that is the oral stage, anal stage, and the third stage of Oedipus. So accordingly, these three forces are being related to the stages of miasm, to the miasm when during the moment of conception, when the gametes of father fuse with the mother. So these three forces come together, and the body, it goes inside the body, and this will remain until the end of the life. These stages will come out as per the stage of the patient, as per the presentation of the patient. The miasm can be considered, the stage can be considered. So this is how this is being related. Talking about the personality types, which we can discuss further also, and these are which we'll be discussing further, and these are the miasms, the main miasms which are being coming out day to day. But yes, the three miasms should be taken as the basic ones, as well as the tubercular by Dr. J.H. Allen. So when you talk about miasms chart, I have compiled it into this chart from Dr. Shankaran's and other sources. So this is a miasm chart which is representing very well the elements of the body which are being affected as per the miasm stage, as per the miasm of the body. When you talk about organs, which miasm affect which organs. When you talk about psychosis, the kidneys and urinary would be affected. When you talk about syphilis, heart and circulatory would be affected. When you talk about Psora, neurosystem, bone system would be affected. So mentally, the patient dwells upon, when you talk about psychosis patient, he dwells upon sex and other things. And when you talk about syphilis patient, he becomes greedy. He's towards the greed because of that fire element inside him. And when you talk about Psora, when you talk about Psora, so Psora is being related to pride and towards the proud feeling towards this affections. When you talk about socially, how these miasms will relate, you can have a look that psychosis usually usually is get very will be affected by vaccination, bad effects of vaccination. You must have seen many remedies like puja or many of the other remedies which are being used for bad effects of vaccination. So yes, why this is acting? Because of this vaccinosis effect, which is being related with psychosis. And bad effects of alcohol maybe in the syphilitic patient. And when we talk about toxic elements, toxic effects, so that can be related with Psora, like you can see in Nux vomica and other remedies which are being affected by toxic elements. So when you see these remedies, so Dr. Hahnemann and all these stalwarts have stated that Psora, when you relate Psora, so the remedy which is being related to Psora is Psorinum. When you talk about syphilis, it's syphilinum, and when you talk about psychosis, it is medorinum. Though Dr. Hahnemann has mentioned about Merksol in syphilis, as well Thuja in psychosis, so sulfur in Psora. So you must remember all these remedies when you are dealing with cases of So when you are dealing with these such cases of Psora. So I just want to gist you about why you should use this miasm, or why is miasmatic diagnosis important in prescribing. This is being taken from the source books of Master Hahnemann as well as Dr. Banerjee's book of miasm. So what he says is why you have to incorporate miasm into your prescribing is because of three things. One thing is contaminated picture, one second thing is conjoined picture, or when there is scarcity of symptoms. So now we'll study how you're going to get the use of miasm in such three cases. See, when you are having a patient whose presentation or whose symptoms are not being able to express, or there is an indolent patient, or when the symptoms are being masked by suppression, by any remedy, by any excessive use of allopathic drugs, so you can consider if you consider miasmatic diagnosis that moment, so that would help you out, how we'll discuss in the further slide. So second, when you have a conjoined picture, when there is an original malady and as well as there is a drug induced disease, so drug disease, and when these both compile, so there is a conjoined picture of disease, and you need to prescribe, and you're not getting something like what should you do at that moment. So that moment miasmatic diagnosis would be a very good help to you, and when there are scarcity of symptoms, that would again be a good help to you. These all things, when you guys will be diagnose the miasm, this will help you to know the actual psychic essence, the nature of the individual, and you'll get to know when you have to change the remedy, when you have to change the plan of treatment. So supposingly you've given a remedy that relieved the patient, but the patient has come to a saturation, and now there are new symptoms which are occurring, and you have to prescribe a different remedy. But when you talk about miasmatic diagnosis, and in such cases, the patient is still presenting Psora. He was into Psora stage, and he is still into Psora stage, or he was into psychotic stage, he is now into Psora stage. So you need to, with the help of miasm, you will get to know that what actually is the plan of treat, what actually remedy change is needed. You will prescribe, but if you prescribe the miasmatic remedy that is relating to the miasm of the patient as well, you'll get wondrous, I would say you'll get miraculous results in such cases. So when you talk about suppressions, suppressions can also be cleared by miasm. When you give a miasmatic remedy, anti-miasmatic remedy, suppressions can come out. When you talk about presenting symptoms, you will be able to clear up those presenting symptoms from their root, from their origin. When you talk about this miasmatic diagnosis, we have given the anti-miasmatic remedy. So when you talk about anti-miasmatic remedy, so when you talk about susceptibility, if you talk about future aspect, the patient would also become better. He'll have improved things to the susceptibility to get the infection or strengthen the constitution. This anti-miasmatic remedy would surely help. So when you talk about miasmatic assessment, how you need to assess the patient, or how you need to assess the miasm of the patient, you need to uncover the each and every layer of suppression through case taking. You have to bring out that outermost layer, which is actually the miasm of the patient, and the and presenting as manifestations. So that moment would be great, obviously. So that would actually lead to the miasm of the patient, and then you can find an anti-miasmatic remedy. Supposingly the patient was into a miasm one day, and then now his first layer is being removed. Now he comes to the second miasm. Now he reveals the second layer with a different group of symptoms. That time you need to fetch out, you need to uncover those different group of symptoms, those different layer and those different miasm, and you need to assess the patient according to the miasm. If you gain all this, if you gain all these, then what Master Hahnemann quotes, he says, he therefore must first find out as far as possible to the whole extent of the whole all the symptoms belonging to the unknown primitive malady before he hope to discover medicines. Agar when you are prepared and you get to know about the extent on the unknown primitive malady completely, then only go to discover medicines, because then you will be able to heal and wipe out the malady in its whole extent. This is what Master has to say in chronic diseases. So this is being described by Dr. Banerjee, that how you can prescribe classically based on miasms. You need to form the miasmatic totality. When your patient comes to you, you need to form the totality of the symptoms. You need to form the essence of the case, like you need to know the gestures, you need to know the postures, you need to know the behavior of the patient, each and every aspect of the patient, and that should be compiled, as well as the keynote of that case, the PQRS, the peculiar characteristic symptoms that are being quoted in 153 aphorism and the 209 aphorism of Hahnemann's organon of medicine. So you need to compile all these together, and when all these MTech things are being combined together, you will prescribe a remedy on this four basis, and I am damn sure that you'll get miraculous results, because that would be the most minimum remedy reaching to the cure of the patient, restoration of the patient in a very gentle way. So now we'll study Psora. That is that what I would be discussing. Everybody knows that it is being derived from the word Psorat, that is having a Hebraic origin, and it means a fault, a pollution, or a stigma. And everybody knows that most of the chronic diseases out, this is Psora is known as the mother of all diseases. Out of eight, if you talk about eight marks, then seven out of eight chronic diseases are being occurring due to Psora, due to the fundamental miasm Psora. So maximum diseases come under psoric influence. And if you talk about Psora's origination, so before Hahnemann gave the word of Psora to the miasm, he also referred, Psora was being referred to those things, to those manifestations, to those leprous manifestations, and plagues like leprosy was prevailing, plague was prevailing. So those diseases were being called as Psora that moment. So usually in Greek, when you talk about Psora, actually means cutaneous disease, internal itch. Everybody knows that itching is the voluptuous, itching is the marked manifestation, the primary manifestation of Psora. So when you talk, when this Psora is in the main stage is the primary manifestation that results in the itch, then it goes on to the latent taint in the system, preventing cure of a certain disease. Like it will go on into the latent stage, and it is being considered as the only real fundamental cause and producer of all and innumerable forms of disease. So you must remember Psora when you are dealing with any of the chronic diseases, because anti-psoric treatment would give your patient actually that would be a bliss for your patient. So this creates susceptibility, and Psora is actually, the germ is actually that pollutant which will give the susceptibility to all other miasms, to all other diseases. So when you are, once you are infected with Psora, that means you can be infected with any other miasm in the coming future, because you already have a taint of Psora inside your body, and you can get infected of any chronic diseases. So when you talk about history, this is just a gist I have taken from the source books, that in the Bible leprosy was mentioned, that that itch was being mentioned as Psora. When you talk about 3,400 years ago, so these words like Gallifid was being discussed for herpes, lichen planus, tetany eruptions. So Moses called it as Psora. And when you talk about Alexandria, Psora agria was being called by Alexand in the Alexandria. So this is the mother of all miasm. How it is being considered as the mother of all miasms? Usually when you this is a history being in the middle age of Europe, in the middle ages in Europe, usually this was being considered as leprosy. Then when it moderated, when it came out, evolved, when you talk about evolution, so when it evolved, it resulted in external horrors of Psora, like the symptoms came into mental level, these symptoms came into physical level. Everybody knows how a leprosy patient is, and such external horrors of Psora was being seen, and these things were being considered, and the end of the 15th century, it appeared only in the form of common eruption of itch. That is what was being termed as Psora. So these are three stages when you talk about Psora. These are some of the things which, when you get infected with Psora, that can result in psychosis. When then you lead to pseudo-Psora, and after that the stage can come as syphilis. The stage can go towards vaccinosis, hepatitis, lymphosis, HIV, AIDS, mystery, and then ultimately to the cancer. So this actually is being again taken from a source book, the stages of Psora. So these stages of miasms. So you can remember this once how these things react. What is the positive? What is the neutral? What is the negative thing? So this is the moment of infection, and once the body comes in contact with a patient who is suffering from Psora, that moment of infection only you will get inside that the Psora will get inside your body, and nothing can actually prevent you from that miasm. Then once you come in contact with Psora, the moment you come, and then the infection spreads to your whole body. This is the most infectious miasm, and this can be in the vesicle, in the eruption, you can say, in any eruption, in any pustular eruption, in the fluid of the vesicle, or it can be transferred through a touch, even a contact even, and usually it can transfer from the mother to the child, or the nurse can also infect to the baby. So usually what happens is this may be mere a material substance of parasite, which can be an infective agent, or actually a living thing that can go inside the body, affect the dynamic state, affect it dynamically, and results in the form of disease. That is the dynamic expressions, and results in these different types of symptoms. So when you talk about psoric miasm, how this Psora develops is the repression. Why is this repression? The defense mechanism is because why Psora results is psoric miasm was born from the moment man started to use repression as the defense mechanism. When you are suppressing your things, whenever things are being suppressed, like your itch is being suppressed, your skin eruptions are being suppressed, something is being suppressed, you are repressing, and you are using those defense mechanisms. So that moment only Psora would develop, and that is being prevailing since long years, since the man has started using repression as the defense mechanism. this is already known by everybody that the Psora patient is extremely sensitive, and they react on exposure to any sort of stimuli, whether it's noise, whether it's light, whether it's odor, and any of this the things which results in the production of functional disturbances like headache, nausea, etc. When you talk about other symptoms that result in voluptuous itching, tickling sensation, burning, which will ultimately result in inflammation and leading to the congestion. This is how the Psora will evolve. And peculiar cutaneous eruption accompanied by intolerable voluptuous tickling itching is the marked you can say red line symptom, red line manifestation of Psora, which you should remember when you are dealing with Psora or when you are reading miasms. So you should know that this is the marked manifestation. And no other symptom is so pathognomic, no other symptom is so exact than the pruritus, than this itching. It is actually an internal disease, though it is believed as though it is presenting as an external disease, but actually it's an internal disease. So itch vesicles may occur, or these vesicles may be suppressed, and then it goes to the latent stage, and then it will result in one or the other cases into secondary manifestations, in fact. So when you talk about Psora's manifestation, this everybody knows that it is due to deficiency, and it is due to something is lacking in the body. There is insufficiency in the body. When you talk about mental level of Psora, there is inhibition, there is reduction, there is decreased understanding. There will be patient who will be imaginative, conceptual, and they'll be limiting their life. So such would be the manifestation that will be presented due to deficiency in Psora, due to that insufficiency. And physically they'll have an unhealthy cracked skin. This is how this evolution is occurring because of that lack nature of Psora miasm. This will be reflected in the mental level also, and physical level also. So physical level, the dry skin may be there, scaly spot may be there. Master Hahnemann told Psora as Hydra-headed monster. So why he told? Because Psora, when you talk about this picture is being taken of Psora to just you out actually what is Psora, and you can remember it very easily. Psora are usually active people who are very industrious, who are very workaholic, who are very intelligent. And when you talk about their sensitivity level, so they are very sensitive to all stimulus, whether at mental level, whether at physical level. They are very oversensitive, they are emotional, and all kinds of sensations they'll feel very hyper, like they'll be feeling such sensations very closely, very from the heart. They'll also worry about future, they'll continuously theorize, overthinking would be there. They'll be having and physically they'll be weak. Because of that lack, they'll be fatigue, they'll be easily weak, weakness would be there, prostration would be there, fatigue would be there. And when you talk about this feature, they'll be hungry because of this weakness, because of their fatigue, they'll be hungry, they'll be emolerated after eating, they'll be emolerated after natural discharges. Whenever the body is being excluding its discharges, like urine, they'll be excluding, sweat, they'll be excluding, or whatever discharge will occur, they'll feel better. Normal discharges se, natural discharges se, and they'll be better by warmth as well. Because of this physical weakness, because of this oversensitive weakness, they are very susceptible to cold. So you should remember this, that these susceptibility to cold and emolation from warmth and such susceptibility, such oversensitivity can lead to functional disturbances at the body, which may be presenting in the form of numerous skin eruptions or morning diarrhea or many other symptoms. So this is all, it is the Hydra-headed monster nature of Psora, which is being quoted by Master. He also quoted in the chronic diseases, page number 14. He said that there are 59 symptoms and major conditions that was being selected by Master, and they were being repertorized using Kent's repertory for this Hydra-headed miasmatic nature, that is involving tubercular pseudosora nature of this Psora element as well. So when you are going through Psoric remedies which are being quoted by Master, there were 48 remedies which Dr. R.P. Patel has also mentioned in his book about those 48 remedies. So those out of 48 remedies, you can go through these rubrics as well in the Ken's repertory, and therein you can compile together what all medicines Master told can be used as Psoric remedies. So this is being this I have quoted just to note, just to make you aware that 48 remedies the Master Hahnemann told, but yes, 59 symptoms also he told, wherein you can find Psoric remedies in Ken's repertory. So you can go through them. So when you talk about personality of Psora, we already discussed how they evolve. There is a lacking nature. What they'll be presenting is they'll be having highs and lows. Their life would be continuous struggle. They would be having a continuous struggle. I'll tell you how they'll be struggling through the life. Yeah. So their whole life would be a struggle. They'll be hopeful. Sometimes they'll be hopeless. So they'll be struggling to survive. They'll be struggling to recover themselves, to maintain their position in life. They'll be always struggling. Psoric people. And when you talk about their anxiety, they'll be very anxious. They'll be having very doubts about their abilities. They'll die. Their life is shit, and they're about to die. They should die. There is very lack of confidence inside them because of this continuous struggle in their life. They'll be tired, they'll be worn out. But actually, failure does not mean death or end of the world for them. So their failure won't result in the death. They cannot be. That comes in the further miasms when you talk about suicidal tendencies, etc. But yes, they'll be doubting about abilities, and they'll think that life is shit for them. So when you talk about this personality, there will be highs and lows in the life of Psora person, and he'll have constant anxiety. They'll be fearful that he cannot do things, that he's not capable of doing things, or he'll have some insecurity in his life. Though he'll be mentally alert, he'll be active, they'll be very intelligent, they'll be very industrious, they'll be very workaholic patients. But at the same time, they'll be philosophers as well. They'll be having good philosophy. You can relate this to Sulfur, who is a very Sulfur is being called as a rugged philosopher, who is towards those philosophers, those people who keep on going on their philosophies, and they are very dirty. They are very dirty looking. So you can relate to Sulfur as well, that those people, Psoric people, are philosophers. They have a changeable tendency. They love to keep themselves untidy, and this is again a feature you can relate with the drug also. You can study materia and organon and miasm all together with the relation of remedies. That would be an easy for you, as well as you will be able to remember things very easily. At the same time, they'll be very restless, anxiety about the future also. The central theme when it comes is weakness or lack only. They'll have lack of strength, they'll have lack of power, they'll have lack of stamina, and they'll do anything and everything to survive. They'll be very, they'll have a feeling that they're very small, they're very weak, they're unable to succeed in life, and they'll be very overwhelmed by the demands that life make on him. So when you talk about these demands, overwhelmed emotions of these Psora, so they'll try to do everything and anything because they want to succeed in life, and they'll have the children you may see, they may have fear of dark, fear of strangers, fear of new situations. And you can see the symptom that this fear, those people, when you come across such patients who's having fear, and what they'll do, they'll buy insurance policies, they'll make savings for their retirement, they'll rent safe deposit boxes and such things. When people are doing, they are towards the Psora. So do remember, when you see a patient who's buying insurance just to secure his life, who will be saving for his retirement, those people are towards the Psora nature. When they go into the latent phase, they'll be that means that the Psora jo ich aaya, the skin eruption eye, that became suppressed, and they went into the, that was being suppressed, and that the Psora went into the latent stage, latent phase. So in those phases, the patient would become mentally alert. These symptoms will be seen. They'll be aggravated in new moon. They'll be aggravated in the morning, winter season, standing, because of that cold susceptibility to cold, and they may present as burning taste, swollen lip. They'll have fear of death. They'll be oversensitive. They'll be weeping, and they'll be moderated by scratching, sleep, etc. And when such symptoms are in the latent stage and they are being provoked, they are having some acute exacerbation, or they have some like there is a ping, you can say that they कोई सो रहा है उसको उठा दिया है उस स्टेज से, so कुछ भी करके हिला कर, या कुछ भी aggravating factor आया, exacerbating factor आया, तो क्या कैसी प्रेजेंटेशन आएंगी? यू विल सी अ प्रेजेंटेशन, मे बी पेशेंट में कंप्लेन ऑफ वर्टिगो, मे पेशेंट में कंप्लेन ऑफ हिस्टीरिया, पेशेंट में कंप्लेन ऑफ पैरालिसिस, पेशेंट में कंप्लेन ऑफ कैंसर, दे मे हैव गाउट, आर्थराइटिस, रीनल स्टोन्स, urinary stones, and impotency, depression, epilepsy. Such manifestations may be seen in secondary level when that latent stage is being pinged by somebody, and that will result in the secondary manifestations. So what you compile and what you come to the gist is that all hypos, anything or anything lacking, anything lower, anything lessened is Psora. So you can say hypoplasia, atrophy, anemia, less of blood. So such things can be considered under the Psora. There may be scantiness, there may be absence of at the mental level, at the physical level also. They may be studious, they may be very intelligent, but they are usually easily fatigued, they become usually tired, and they are philosophical, they are thoughtful, but they don't have any practical sense at when you talk about Psora. They have desire for sweets, they have aversion to milk. When you talk about malignancies, they may be prone to malignancies at the age of 40. They have mental restlessness, they have unrefreshing sleep. So such features you will see of psoric miasms. Itching may be there without pus, with pus. These are the characteristic symptoms when the patient is suffering from itch or some eruption, skin allergies, and that is in the Psora stage. They may have watery discharge from nose, acidity, burning. Such maximum of the chronic diseases which are being occurring are due to Psora. So you can relate when they are having only functional disturbances in the body, so you can relate it as Psora. When you talk about the hypo thing, the patient is having lacking nature, but that due to that lacking nature, we already discussed that they are very oversensitive, where they are to all stimulus, whether at mental level or whether at physical level. So this hypersensitivity is seen in the Psora in the form of the primary anxiety of death. There is anxiety of death. The patient, as soon as he is born, he becomes very anxious of death when he is infected with Psora, and he'll be the such desire for death may be triggered by any external stimulus, like if somebody is ill or whenever somebody touches anybody, Psora would trigger inside the body, and they'll have anxiety. So this is all about Psora, and when it is being compiled by Dr. Banerjee sir, he compiled it in the form of this thing that you can relate Psora as these are the keywords and these are the criteria. When you talk about Psora, they'll have a irritation at the level of physical level or at the mental level. When you talk about physical level, that irritation will be seen in the form of itching all over the body. When you talk about mental irritation, there may be internal turmoil inside the body, like anxiety would be there, mental alertness would be there, there may be apprehensions that something bad would happen, something misfortune would happen. And we talk about the criteria, you need to remember about Psora: lack, scantiness, absence. There are hypo things, there is oversensitiveness, which is being seen already in the irritation level. Then you need to remember about hypos, that is like lack inside the body, scantiness, absence, like in anemia, atrophy, ataxia. So any disease condition which is presenting as characterized by deficiency, something absence, along with hypersensitivity nature, easily if immunity is so low that the patient is very increased to catch infection, so that moment you can think of Psora. So these are few of the points which are being which are being discussed by different stalwarts. I have compiled together. Master said that it is the most ancient, most universal, most destructive, and most misapprehended chronic miasmatic disease, which for many thousands of years has disfigured and tortured mankind. It is the mother of all disease. And he is saying that Psora is contagious by the slightest touch. It is, you can get infected by easily by the slightest touch. Psora will come inside your body, and that will present as itch, which was that time known as itch, and now it is being known as scabies, you can say. And it will be compiled. And when you talk about Master Hahnemann, he quoted 48 anti-psoric remedies, wherein you can find the list in the chronic diseases, as well as you can find it in Dr. R.P. Patel's Miasm book. So on chronic diseases by Dr. R.P. Patel. So these are 48 anti-psoric remedies which Master Hahnemann has used while he was researching on chronic diseases for long 12 years, and he came out with the theory of chronic diseases in 1928. After this long 12 years of his research, when he was dealing with cases, they were becoming cases which were showing recurrence, and they were not showing cure in spite of prescribing similar remedy. So Hahnemann sir writes, the cure of an old Psora has been deprived of its eruption, whether it may be latent or quiescent or already broken out into a chronic disease, can never be accomplished with sulfur alone, not with sulfur baths, either natural or artificial. So you need to prescribe the remedy as any of these antipsoric remedies whenever you're dealing with Psora patient, whenever you have complaints which are being presenting as Psora. I have a few of the quotes which are being mentioned by many of these stalwarts. But before that, I just want to discuss a case of Master from chronic diseases, that a girl had a violent eruption of itch on the legs with large ulcers on the bend of the knee. एक girl थी, उसको eruption हुआ था legs में, and then he had large ulcers on the bend of the knee, and she was being attacked with smallpox, which in her life, which was suppressed, and that resulted in the inflammation of the white of the eye and the eyelids, and she was having itching, suppuration, and the vision was also floating. So this she was suffering for 2 long years, and then for 3 days she put on stockings of a child with the itch over the itch, and on the last day a fever, she suffered from fever, dry cough, tension in the chest, and she had a nausea feeling, inclination to vomit. So such cases were being dealt by Master, and the sweat broke out. The remedy was being given, which increased until erysipelas broke out on both the legs. So the patient suffered more. The eruption came out. The eruption came out on both the legs, and on the following days, these passed over into real itch. It was itching badly, and then the eyes improved. So this is what is actually Psora when it is being suppressed. Until and unless it is being brought about, open up, then only the patient will get actually cured. Otherwise, it will keep on being in the latent stage, and it will keep on affecting the body inside, and it would affect the vital organs in the upcoming future. So you must remember this when you're dealing with the cases. Similarly, there are more cases being quoted, which we can discuss if the time permits. I just want to quote one sentence of all the masters who have quoted about Psora. So Dr. J.T. Kent says, he was a Swedenborg. He believed in Swedenborgian philosophy. Dr. Kent, he was into evil, that disease happened due to evil. If if everybody has read philosophy, Dr. Ken's philosophy, so you will see he has talked about superstitions and the people are being diseased because of the evil nature, because they have done bad to people. So Kent has already said about Psora, and he has signified it as the fall of man due to his sinfulness. So he has said Psora in his highly moralistic light. It is the foundation. It is the foundation of all sexual miasms which came afterwards, and Psora is the foundation of all the sexual miasms like Sycosis and Syphilis which came later, and it is the beginning of all physical illness in the human race, and it is the foundation of actually sickness. So you must remember him, that he believed it as because of the sin being done by the human beings, Psora develops. And Psora leads to other sicknesses as well, and the other miasms as well. These are few of the quotes which are being quoted by Master Kent. This we can go in the end if anybody has query. What has Dr. J.H. Allen to say? He said one specific cause lay at the bottom of all. Whether it's the chronic disease, whether it's acute exacerbation of disease, that is Psora. So Psora is the basic miasm again, which presents as the parent of multitude of functional and pathological changes in the human organisms. In Dr. Stuart Law's philosophy, Dr. McConkie has mentioned that on the basis of bacteriology, when you talk about Stuart Laws, you relate it in the form of bacteriology. He has discussed in the form of general pathology way about Psora and all other miasms. So they've already said that Hahnemann really taught in regard to Psora as the cause of chronic non-venereal diseases. And Dr. Claus has mentioned that it is the Psora is merely the dyscrasia or the diathesis, actually, which Master said that which will be presenting as morbid condition and diseases. So when you talk about Dr. Roberts, he has mentioned that in fact not only was Psora not only was Psora considered the mother of all diseases, but it might well have been considered as the source of all subjective symptoms, especially those described by the patient's sensation as if. His book is also there, Sensation as If, by Dr. Roberts. So you must know this, that in classifying those constitutional diseases, the venereal classifications, it was being noted that the subjective symptoms which are being present in the degree in which the Psora has been present in the symptom. And he said, the vast majority of diseases have the Psora as the mother of all diseases. So last and not the last quotes from Dr. J. Wait, from other doctors, that Psora is the most sensitizing miasm, and Master Hahnemann also says in the Organon of Medicine that Psora, the only real fundamental cause and producer of all the others numerous diseases. And Dr. J.N. Kanjilal also mentioned the mind is hypersensitive and hyperactive to slightest stimuli, that both endogenous and exogenous, but produces nothing. And when you talk about Harimohan Chaudhary sir, this is a quote by Dr. Kanjilal that Psora is a sterile philosopher. So you must remember a sterile philosopher when you talk about his Psora. And Dr. Hariman Chaudhary sir also in his Miasm book has mentioned Psoric patients have weakness of memory but full of imaginations, emotions and sensation without any object basis. So you must remember all these compiles into Psora, and now we are going to study the other two miasms by our another great speaker. So I hand over the session to him. I have done my part. So I'll hand over the session to him. Dr. Akshay, are you with us?
Yes, madam, I'm right here.
Excuse me, ma'am. Ma'am, you have a doubt. मतलब ये queries from the people?
We'll discuss the queries in the end once
Okay.
Dr. Akshay winds up. Yeah. So
Okay.
yes. Okay. Akshay, you can start the screen share.
Oh, yeah, sure, brother. Okay, I'm starting. Madam, is the screen share available?
Yes, it's absolutely visible. Yes.
Yes.
Good afternoon, everybody. Today, first of all, I would like to thank Dr. Yashika Arora, madam, for giving such a wonderful presentation about Miasm Psora. So we know that today's world is the world of triamiasmatic states, and it becomes really necessary to understand the other two miasms. So I will be dealing with the portrayal of psychosis and syphilis. So the topic of my presentation is portrayal of psychosis and syphilis. So first of all, we already have had the discussion about what are miasms. So I will give a brief detail about what miasm is. Miasms may be defined as an invisible, inimical, dynamic principle which permeates into the system of a living creature. Now, I want you to pay attention to it. What is it? It is invisible. It is something that we cannot see. It is inimical. Inimical means it is our enemy. Dynamic principle, something that have the dynamic powers, which permeates means enters or diffuses into the system of a living creature. So when we're talking about the living creature, then we are talking about all the organisms. So this miasm creates a groove or stigma to constitution. So what is constitution? We all know that it is the physical and mental buildup of an individual. So what is happening is this miasm that enters our body, it creates a space. Like our body is continuous, we have the holistic concept, but there comes some stigma. And this stigma can only be eradicated by suitable anti-miasmatic treatment. If effective anti-miasmatic treatment does not take place, then the miasm will persist throughout the life of the person and will be transmitted to the next generation. So I hope the definition of miasm is clear. So miasm is basically a force, just like we have vital force in our body. So basically what